Hello all, it's Dr. Ruth Doughton here. I'm a board certified adult psychiatrist who uses metabolic and lifestyle interventions to get at the root causes of mental health. And so today I'm going to be talking about some of the absolute and relative contraindications to implementing the ketogenic diet. So before we get started, I have to start with a disclaimer that this is not medical advice. We're not entering into a doctor-patient relationship. And if you're at all considering implementing ketogenic diet or therapy, please talk with your mental and medical health providers to see if that might be right for you. Additionally, I also want to say that because this field is so new, we really don't have formal guidelines about these things and these interventions at this point. And so you will absolutely find providers in this field who have different opinions. And so those that are discussed in this video are reflective of my own, based on my own personal and clinical experience, as well as research. Okay, so that being said, let's go ahead and get into it. So there are relatively few absolute contraindications to a ketogenic diet. So let's go ahead and start with the medical contraindications. These are going to include first rare inherited metabolic disorders. These are things like glycogen storage disease type 1, carnitine deficiency, acute intermittent porphyria, to name a few. If you have one of these, you probably know there's a long list of them. And so if you do have one of these, please do not attempt to implement a ketogenic diet. Absolutely not without talking with a provider to see if it might be something that would be safe for you. But in general, we would recommend avoiding this intervention for these individuals. The second medical contraindication is essentially when someone is acutely unstable. So if there's acute organ failure, so think heart failure, kidney failure, liver failure. And when I say acute, what I mean is that there's something that has changed all of a sudden and the person is all of a sudden unstable and this organ is really doing poorly. This is different from chronic, which is something that has slowly developed over time. And in these cases, a lot of times the ketogenic diet can actually be helpful. So like for things like cardiovascular disease, fatty liver disease, chronic kidney disease. But if it's an acute, meaning like quick onset, severe symptoms, this is not the time to be implementing a ketogenic diet. Another medical absolute contraindication is for patients who are prescribed a medication class called SGLT2 inhibitors, and this is a diabetes medication. These medications end in the word gliflozins. So if you're on a medication that ends in gliflozin, then it is not safe to pursue a ketogenic diet while you're taking this medication. The risk is that you could go into ketoacidosis, which is a dangerous, unstable metabolic state. This is different from nutritional ketosis, where your ketones are definitely in the 5 or lower level, and this where it's perfectly healthy for you to be in that state of ketosis. In ketoacidosis, your ketone levels are sky high, your insulin level is essentially zero, and then your body is in a state of acidosis. And so if you are on this medication and you really want to pursue a ketogenic diet, then you might want to talk with your medical provider who's managing your diabetes about potential other alternatives for diabetes medications, because there are a lot out there. The last contraindication is for those who are pregnant. However, I will say that we say it's an absolute contraindication, but for those who have already adopted a ketogenic lifestyle, there are certainly some individuals who've been able to maintain that lifestyle and low carb diet during their pregnancy. But I absolutely would not recommend attempting to implement a ketogenic diet for the first time during pregnancy. And so the reason for this being that pregnancy is naturally a higher insulin and growth state, which is really going to work against ketosis because ketosis is a low insulin state. So if someone is not already keto adapted, it could potentially be dangerous for them to enter into a state of ketosis in this physiologic state, dangerous for mom, dangerous for baby. So caution has to really be used in this population. Additionally, along those lines, we have to use caution in individuals who may be nursing, so breast or chest feeding. Again, this is similarly a high insulin, high growth state because you're producing milk, you're still feeding your newborn. And so again, it's going to be difficult to maintain ketosis and still maintain a good milk supply. So again, if you're an individual who's been keto adapted, lived a low carb lifestyle, then this may be fine for you. But for your average person, if you're considering attempting a ketogenic diet for the first time, then I would recommend holding off until at least 6 months postpartum, when you're through that like first really intense phase of breastfeeding. And then at the same time, if you do choose to pursue a ketogenic diet for the first time while breastfeeding, I would recommend working with a keto dietitian or coach if possible, to ensure that you're getting adequate nutrition for you and your baby and that it's not negatively affecting your supply. Okay, and of course, if you really wanted to pursue a ketogenic diet, you could always consider transitioning to doing bottle feeding with formula if the benefits outweigh the risks for you in terms of pursuing ketogenic therapy. Other relative medical contraindications include patients who have severe pancreatic dysfunction. So think about people with chronic pancreatitis or pancreatic insufficiency. So people who've had a Whipple surgery, so that's a surgery where you remove part of the pancreas. Usually that's because there's pancreatic cancer. And these individuals, they just don't have a properly functioning insulin system because it's the beta cells in your pancreas that are producing the insulin. So another situation that would be a relative medical contraindication is severe kidney failure. So if you have this, you may be familiar with the term of estimated glomerular filtration rate, which is an estimation of how well your kidneys are working. And this would be ordered on a comprehensive metabolic panel. If you have this value at 45 or less, then we would say that this is it's probably too high risk for you to be pursuing a ketogenic therapy. That being said, if you have chronic kidney disease and your eGFR is not quite that low, it may be beneficial to you to try. Another relative medical contraindication would be for individuals who have familial hypercholesterolemia or hyperlipidemia. So these are familial cholesterol disorders. It doesn't mean, this isn't for people who just have a little elevation in their LDL or their triglycerides. For those things, it may be helpful for them to be on a ketogenic diet, although this is a separate topic, which we can absolutely discuss in another video, but a ketogenic diet can slightly increase your LDL on average, but it depends on the individual. But back to talking about these familial lipid and cholesterol disorders. In these disorders, people's cholesterol and lipid levels are sky high. And their body has a problem with metabolizing the cholesterol. So in these situations, we generally would not recommend pursuing a ketogenic diet unless you're getting really close follow-up and maybe you're getting like coronary artery scans to make sure you're not developing atherosclerosis. It would require additional monitoring. So the only absolute psychiatric contraindication is going to be for patients with anorexia nervosa who are underweight. It was previously thought that the ketogenic diet should be avoided in those with eating disorders in general, but there are more studies now that are coming out to show that it's actually been used successfully in individuals with weight-restored anorexia nervosa as well as binge eating disorder. It's an emerging area of research, so we primarily have case studies at this point. And so given this, that we're in this emerging early research stage, I still wouldn't recommend ketogenic therapy for these conditions as a first-line treatment. But if a patient has failed traditional interventions for eating disorders, then it may be worth considering, especially depending on what comorbidities they have that may also benefit from a ketogenic diet. So I would definitely recommend having a keto dietitian or coach or other professional work with individuals who fall into this category, as it would be very important to have someone helping them to formulate a well-formulated ketogenic diet that is going to meet all of their needs and, if necessary, result in either weight maintenance or weight gain, depending on that individual's situation. Additionally, although individuals can be successful with ketogenic therapy with intuitive eating, I will say, and we'll talk about this in another video, that tracking macros is important in the beginning at least. And if this is too triggering for someone because of their history of disordered eating, then it might not be right for you right now. Okay, so there are definitely a number of other conditions or situations in which monitoring is required. And I did try to make a single video for all of these, but it was too long. So I'm going to pick up with those in the next video. But thank you so much for taking the time to listen to this one, and feel free to like and subscribe for more content about metabolic and other lifestyle interventions for mental health.